Hey, welcome back. So Snohomish County has seen a severe spike in coronavirus cases this month. So to get an idea of what these numbers look like and what's being done to prepare for that vaccine, I spoke with Dr. Chris Spitters of the Snohomish Health District.
Many people are familiar with what we call the 2-week case rate. So that's the number of cases per 100,000 people in the community, and running up through December 5, that figure is 428 per 100,000 for the past 2 weeks. The majority of new cases continue to be in 20 to 49-year-olds. About 60% overall are in that age group. And roughly 2/3 of the cases are from close contacts or have no known source and appear to have acquired it in the community. This means that people are getting COVID from folks that they know or live with, or in community settings like workplaces, church, and also social gatherings. We have about 44 long-term care facilities that have had approximately 500 cases over the past several weeks. And hospitalization numbers remain high, but relatively stable over the last week or two. As of today, in Snohomish County hospitals, we have 91 confirmed and 3 suspected cases. Of those, 11 people are in respiratory failure and requiring mechanical ventilation to breathe for them. The other thing that we're sadly seeing is an increase in deaths. That is beginning to look like what we saw last spring with the first wave. And in the past week, we had just over 20 deaths in Snohomish County. So that's an increase back from, if you look back into September, we were just having 1 or 2 deaths a week. So those are all signals that COVID is going up and appears to be doing so without any interruption.
Yeah, speaking of interruption, there were so many times I wanted to stop you while you were talking, because so many of the data points that you pointed out made me go, wait, what? So you've lost just 20 people this week. You said 428 infections over 2 weeks. What per 100,000 people? What do we hope to see? What is the number that makes the health department feel comfortable about COVID cases kind of easing off?
Well, certainly in the long run, all our society-wide goal is 0. And right. As an interim long-term measure, we want to get that down to about 25 cases or less per 100,000 per 2 weeks, to really feel comfortable opening society back up. But in the short run, what we'd like to see is that nearly vertical curve that's showing where things have been going over the past six weeks or so. At least see that bend and flatten out and then start to come down. Because the key thing is, as we accumulate more and more cases, people, the more severe cases end up in the hospital, and those are long hospitalizations. Those are already occurring, and so the hospitals start to balloon with large numbers of cases like I just reported. And that's not sustainable for our acute healthcare system. That's going to impact everyone's ability to get healthcare if this continues.
What about the vaccine? I mean, there's a glimmer of hope with that, but it still seems like a far off dream in some ways. What is happening with that? How can you share a little bit more about what's happening, at least in Snohomish County?
In Snohomish County, we've all been planning and preparing for vaccine distribution and administration since late July. We know people want clarity and reliability in these uncertain times. An interim distribution plan for Snohomish County has been shared and posted on our website, as have draft plans for that phased implementation among a series of prioritized groups, starting at either at the most critical functions in society or the most vulnerable individuals, and then working our way through those groups on down to important but lower priority groups as the vaccine supply begins to come out. That serial prioritization will be harmonized statewide, and we will follow CDC's guidance in doing so. And we're also working to get local healthcare providers, the healthcare system, registered to order vaccine through the state and federal channels, And meanwhile, we're gearing up for the intensive public education, communication, outreach efforts that lay ahead to help people understand where they fit in and provide reassurance about the efficacy and the safety of the vaccines that are coming out.
I think that's key, is educating people, because a lot of folks are concerned about that, getting that vaccine. And we've talked about it on this show, I know, before, but educating people on the efficacy of the vaccine and the history of working on vaccines like this, I think will go a long way. So thank you so much for all you're doing and for taking the time to speak with us today. I know Snohomish County has their hands full, so thank you again, Chris.
So Chris also said that in addition to wearing a mask and staying 6 feet away from others, the most important thing we can do to stop the spread is to limit indoor gatherings with people outside of your household. The Snohomish Health District has a wealth of coronavirus information available online. Just go to snohd.org/COVID. Well, everyone has their favorite genre of books, right? Well, coming up, we're talking to one of my favorite authors about one of my personal favorites, paranormal romance. Stick around. New Day will be back after this.
This portion of New Day Northwest is sponsored by Snohomish Health District.